Good evening. Thank you so much for coming. My name is Laércio Marques. I'm academic coordinator here at IED São Paulo, and I will conduct this agenda, Design in Foco, Design in Focus. And it's a great pleasure tonight to receive my colleague, Alessia Rulo. I will present her in a few seconds. And tonight we are going to talk a little about the question related from insight to transformation, strategic design as bridge between healthcare, technology, and business. I'm very happy to receive Alessia to this agenda. We are working together in collaboration between IED São Paulo and IED Barcelona. And as you know, during this kind of agenda, Design in Foco, we receive some professionals, innovators, designers, teachers to discuss questions related to design and innovation teams. And we have a presentation from Alessia in the sequence. And of course, and the most important here, to have a dialogue with all of you. We have a space for a Q&A. So prepare your questions, leave the questions on the chat, and I will pass all these questions to Alessia Rulo. So just to start, let me introduce Alessia Rulo. Alessia is a visionary design leader and strategist with over a decade of expertise in UX, interaction design, and design management. She currently serves as the Global Director of Design and Experience, CX, Research and Strategy at Roche Diagnostics International. And she is also the Director of the Master in Strategic Design Management at IED Barcelona. She holds a PhD in Interaction Design. A recognized expert in shaping transformative, patient-centered health solutions, she excels at leading global multidisciplinary teams through advanced research and concept design. Prior to Roche, Alessia played a pivotal role in 8P's digital transformation by directing cross-disciplinary design teams to define experience strategies for digital services and professional graphics. By seamlessly integrating deep research, design, and lean experimentation, she consistently delivers impactful, innovative solutions driven by strategic insights and collaborative exploration. Alessia, thank you so much for coming. It's really a great pleasure, and the show is yours from now. Thank you.
Thank you so much, Laércio, for this introduction. It's a great pleasure for me to be here tonight with you. There is very little that I can add to this great intro. Tonight I am playing like a double role because on one end I am the design lead for the Master in Strategic Design Management in Barcelona, but I'm also responsible for customer experience, research and strategy in Roche Diagnostics International. So I would like to bring you a little bit my what I have been learning from this role and how strategic design can play a role in a company, starting from the challenges that we are facing at Roche from a healthcare standpoint. So I will just now share my screen. So I will, we can start. Okay. I hope you can see this clearly.
It's okay.
Fantastic. Well, I have been calling this this little intervention the island of automation. And there is a reason for that I will disclose later on in the presentation. But this is it represents in a way the key insight of what we are trying to do, but also the biggest challenge that we are trying to address in transforming, if possible, healthcare for good. Well, let me start with a question for all of you guys. What's the role of designers in a world that does not need more things? We feel that everything has been done. Let's say AI it's somehow substituting a lot of our work as well, no? If we think at how has been automatizing user interface design, for example. So what's our role as a designer, and what we can do to actually, I would say, enabling a relevant, meaningful transformation in society as for healthcare. And maybe a question or an answer to this question comes from Ida Persson, which is a social impact designer and storyteller. She says, rather than viewing the success of our work through the lens of creation and production, we should focus more on measuring our impact through restoration, connection, and amplification. Today, I will explain what does it mean connection, amplification in the context of the challenges that we are facing in Roche. And as design is not just helping in transforming an industry, but is transforming itself as a discipline to serve this scope even better. As I was already anticipating, I am working in the area of diagnostics. And I would say when we talk about healthcare of diagnostic, we have this big, I would say, big question in front of us. Is that a crisis or a collapse? There are several factors that are, of course, playing a role. Let's just focus on two of them. We will be becoming an aging population. By 2050, the world population of people aged 60 years old and older will double. The number of persons aged 80 years or older is expected to triple between 2020 and 2050 to reach 426 million. It's not that we are just getting old, it's how we are getting old and the predominance of some specific diseases in our society. The number of dementia cases will rise from 50 million to 82 million by 2030, and 152 million by 2050. And we can keep on, you can read the numbers yourself. Another important number is what has to do with diabetes. That is called the new pandemic, from 425 million to 629 million. So aging population with chronic diseases such as dementia, that is absolutely, I would say, impacting the way in which people can live, and diabetes. And here, just to set the scene, some additional figures. The cost for managing this chronic disease, such as diabetes or dementia, is going to be increasing as well. 90% of the 4.5 trillion spent on healthcare in 2022 was for individuals with chronic physical or mental health condition, the 90% of the overall budget. Together with this, we have also staffing shortages. The figures tell us that we will have maybe 10 million of healthcare workers missing by 2030s. And the reason for this relies on actually a healthcare system that is absolutely under pressures, and in which, of course, the professionals working there are in a risk of constant burnout, just to make things simpler. Together with that, we are observing the need of personalized care. This one-size-fits-all approach is becoming insufficient, and the market of personalized care, so what is called also precision medicine, is growing by 80.5%, with a total market share of $870 billion in 2030. So this number just, let's say, give us, I would say, in figures, the magnitude of the challenge that we are facing. Medical costs are projected to rise above 10% every year. So that's why the question is, healthcare in 2050, is just a crisis or is a real collapse? We will be able to provide healthcare in the future. And of course, together with the challenges, we also have opportunities. AI, of course, is playing a tremendous role in healthcare. We are seeing the wearable finally starting playing a role. This is, I think the one in this picture is the Amazon Ring, but we also have the Oura Ring that are providing this constant monitoring of several parameters. Also, there was a big acceleration toward digital health and digital, let's say, base technology for health since COVID. And also, in general, a growth of this of the wellness market that, in a way, is an extension of the health market, becoming like a priority in US, China, and United Kingdom, as an example. I especially love this representation because this is provided by Foco, which is a big player for in designing ambulances in Denmark. And Francesca Desmarais, that is like working there, is talking about this continuous of care. And as you can see in this picture, it's a sort of a journey of when and how do we need diagnosis and healthcare services all over our life cycle, from birth to death, moving from preventive care, acute care, or management of chronic conditions until actually we are managing our end of life. So I would say our whole life is is really like determined by this continuous of care. Now, having said all that, which are the key things that we are observing in the work that we are doing in Roche? We are talking more and more of this idea of a shift left strategy. What does it mean, shift left? This means that things that usually happen in specific places or were done by specific actor are actually changing and moving more and more towards the patients. For example, we are seeing the preventive care is the main trend that is moving, in a way, the accountability for the early detection of a problem, of a disease, from the doctor actually into patient, for example, by using wearable devices that are helping us to anticipate the detection of a specific parameters that can be an indication of a potential problem. Similar to that, the care setting are shifting left, moving from hospital and primary care to pharmacies, for example. And Brazil is one example of this decentralization of care settings, where pharmacies, for example, are playing a critical, pivotal role in making health more accessible pretty much everywhere. Not only pharmacies, of course, also community care hubs and homes are becoming key settings where care services can be delivered. This finally means that also the actors and the players' responsibility are moving to the left, from clinicians and nurses to pharmacists, community health workers, and patients, that become like more accountable and, in a way, empowered of providing, I would say, solution for their health challenges. Of course, all those things are maybe easy or clear when they are represented in a nice slide, but what happens actually to people? And in Roche, we strongly believe that in order to not just understand these challenges, but to make those challenges relevant and, I would say, meaningful for the people, really serving their needs, we need to develop a patient-centric experience vision, not just talking about numbers, but referring to the people that are behind those numbers. And these are examples of, I would say, different lens from which we can look at this patient-centric experience vision. We have, for example, Takeshi, which is risking due to his professional life, maybe a possible burnout, and he needs to have like a prevention approach. Or Ursula in Berlin, who can have early signs of Alzheimer's that needs to monitor and manage. So she really needs to have this early detection. Or Kavya in Mumbai, who is experiencing like an acute condition with a respiratory problem that needs to actually have a precise and timely diagnosis. Finally, Travis, Oklahoma, quite disengaged diabetes patient living in a rural setting that has developed comorbidities and is living with like a chronic condition. So how we can deal with the continuous treatment and I would say adoption of the treatment that he has to deal with. Now, when we talk about people, let's also try to understand, okay, what does it mean, all the changes that we are facing in healthcare for people. And here it's important not only to refer to the perspective of the patients, but also the perspective of the people that are providing care or cure to patients. This is from a study that we have been doing worldwide together with Frog Design. And that's a quote from an healthcare professional, a doctor that we've been interviewing in US. And he was reporting to us, technology has moved faster than our ability to incorporate it. Some patients will send you 40 PDF. It becomes difficult to review all. So while we are observing this fast acceleration toward digital technologies, we are producing a lot of data that doctors at the end are not able to process or to, I would say, use efficiently in the diagnostic process. That's another example coming from a patient, again, interviewed in US. So that's a diabetes patient. And he's saying like the learning curve for this pump, the pump is used to actually pump insulin, is extensive. You can read the manual and still feel lost. It's not something you can just pick up. It's taken 4 years to feel confident managing my diabetes. And by the time you finally get it all figured out, they tell you it's time for a new pump. So you need to restart again. And it's interesting here also to bring the vision of who is providing, I would say, diagnosing a test result. And that's actually a Brazilian lab director that we've been interviewing more or less 1 year ago. And he was saying, we envision a future where insurer-approved wearables drive testing, empower patients to request their own diagnostic. There is a significant opportunity for labs to step up, providing direct patient access to results and follow-up, bypassing the traditional doctor's visits. So here you can see how there are different voices pointing at the amount of digital information and how it's difficult to digest it for doctors, the continuous change in technology that is making actually adaptation difficult for patients, but also I would say the vision of lab providers that really believes that they could have a direct-to-patient service that can shortcut maybe some of the diagnostic process. So again, having seen all that, now how does the healthcare system needs to evolve, and what are the implications? Now, when it comes to really understanding those challenges, I strongly believe that we need to pause and actually really rethinking which are the guiding principles for design and for experience in this new environment, which are the ethics that we need to consider, and which are the new regulation that we have to take into consideration. And that's important because it's not just about introducing AI or going digital. It's about doing it in a meaningful way, we are in this age in which we are AI everything, but not everything needs to be AI'd. And here, let me also quote Tristan Harris, ex-Google, now responsible for the Center of Human Technology. He was reporting that is very active in, let's say, the idea of using technology in a more responsible way. And when it comes to AI, he's reporting that 80% of prompts in AI platform are related to emotional and mental health issue. AI is somehow, let's say, covering the role that used to cover doctors. And in the absence of doctors' availability, because they have too many patients to attend, AI is playing this emotional role. And that's maybe good in some cases, but also dangerous in others. By the way, ChatGPT is already developing the health ChatGPT channel. Another interesting element is this idea connected to the role of doctors, for example, is this idea that they know best is actually disappearing. There is this beautiful article wrote by Lucy Neyland, A New Form of Expertise in the Age of Institutional Doubt, that explains how people is actually taking decision not just based on expert point of view like doctors, but more based on, for example, information derived from friend and family or social media, or also TikToker. And here is especially outstanding the case of GLP-1 drugs for lost weight that are migrating into this peer-to-peer space where information is exchanged, let's say, without any medical supervision. So now we have been really looking at the different aspects of how healthcare and diagnostic process are transforming, and to some extent, what's the role of technology over there. And if I had to really summarize all those inputs, I love this quote from one of our business leaders in Roche. And he was actually referring to the island of automation. That was actually the title of this talk. The last 30 years have been defined by our ability to automate. The next 30 years will be defined by our capacity to orchestrate. And if you ask me, which is the biggest challenge that we are facing as designers and as a strategic design team, is how to orchestrate a different experience, a different end-to-end solution in a big corporation and beyond a big corporation, because at the very end, those challenges require the collaboration of different entities, actors, institutions, not just one company. Now, if you have the time, I would like to show you the vision of Roche when it comes to orchestrate and create business innovation for healthcare.
The world and healthcare are changing. But what does that mean for diagnostic labs? Tomorrow's labs will analyze samples with unprecedented speed and minimal human intervention, easing pressure on budgets and workloads. They will harness big data and AI to detect and prevent diseases. They will link patients and clinicians, lightening the burden on healthcare workers. And they will be part of patients' everyday lives, tracking and analyzing biomarkers to improve the treatment of chronic diseases. As laboratories evolve, professionals will take on new responsibilities. Lab staff will need systems that adapt to the tasks in hand. Lab managers will rely on advanced analytics for guidance in real time. Lab executives will depend on predictive insights to create resilient strategies. By delivering these changes, our impact will go beyond the lab. We can help clinicians get vital decision support and enable patients to enjoy personalized diagnostic insights. Like diagnostics, Roche is changing, evolving from a supplier into a constant partner, viewing customer journeys as dynamic, interconnected cycles. We aim to excel in customer experience by building on 4 key pillars. We can be a lighthouse, monitoring emerging technologies and behaviors, and co-creating transformative healthcare services. We can tailor at scale, delivering proposals based on specific customer needs and challenges. We can help labs manage growth, upscaling processes, simulating changes and upskilling staff. And we can ensure labs are always running, providing predictive maintenance and self-troubleshooting to ensure zero downtime. By taking a bold and innovative approach to customer experience, we can set a new benchmark in excellence, elevating ourselves today while preparing our customers for tomorrow.
Well, that's an example of how we can develop an orchestrated approach in a company like Roche. But if I have to be honest with you, those vision videos are possibly powerful, but they do not make things happen. So as designers, as strategic designers, what helps to make things happen? Well, for example, when we talk about how labs are transforming and the future of laboratories, sometimes it's really about simplifying the huge amount of information that is in a big company into frameworks that are easy to understand and that allows decision making. And that's creating frameworks maybe is one of our key skill set as strategic designers. And it's really about reducing complexity into something that can be understandable, manageable, and that actually provides insight. Here, for example, we were mapping originally the different areas where we can generate innovation in the diagnostic ecosystem, considering the patient, the clinician, and then the labs professional. But that was not just what we had to do, because in a company like Roche, there are many teams maybe working simultaneously on different solutions. So what we did was not just mapping the innovation opportunity, but also what Roche as a whole was doing towards innovation opportunities. And this gives us some initial insight, because you can see that there are some areas where nothing actually was happening, an area where we were actually making big investment. But that's, again, not enough, because we were also looking at what competitors were doing in those same areas. So you can see as this framework is providing different views that bring lights on different possibilities for Roche to actually orchestrate a differentiation strategy, responding to competitors or just pushing for areas where no one is actually doing nothing, or showing clearly where we have a disadvantage. So again, these are tools for decision making that we do not take alone as designers, but we can massively help business, R&D, science to take those decisions in a much more informed way. So the role of facilitation for strategic design is paramount. Of course, another big role that we are playing to ensure this orchestration and to make things happen is actually building engagement by developing stories, scenarios, artifacts that are helpful for people to think. In this case, for example, you see the GM of Roche Brazil, this guy here, with some lab director of the main laboratories in Brazil, brainstorming together on which of the future trends that we were describing before could actually have an impact on how the laboratory needs to redesign or rethink their business. If you ask me, anyhow, which is what makes more impact from a strategic design standpoint, is developing integration artifact in the form of scenario in most of the cases, but not only, that can really help the organization to think, make synthesis, and amplify their way of thinking. And as an example of this, we are recently playing with AI, in this case, recently developed these real-world diagnostic test scenarios in which, by introducing few variables such as the country, the care setting, the diagnostic test, it generates use cases that can help actually our own organization to think and to understand better where are the opportunities and how to deliver these opportunities end-to-end in a way that is orchestrated. I would say, overall, I believe that, and here I would like to quote Ellen Job, when she was head of research at Space 10, an important part of our work is really forecasting and giving shape to the future. But forecasting is not about predicting the future. It is about creating a future that you want to live in. And that's especially relevant for healthcare, and especially relevant to address this idea of island of automation, where this fragmentation is creating, I would say, this huge level of frustration, inefficiency that goes against the idea of providing care to the biggest population as possible. And with this last quote, that's it. Thank you so much for your attention.
Whoa, thank you so much, Alessia. Amazing presentation. I think we had a lot of points to talk here related to technology, journey, personas, decentralization of the healthcare system. But I really love it when you talk about orchestrate, because I believe this is the main point of the strategic design working. We need to really orchestrate different stakeholders, different disciplines in companies, in business, and I believe that also here in IED São Paulo and in IED Barcelona, we try to develop these skills in your students. So I really appreciate this part of your presentation, because I think it's central in strategic design and innovation working. And we have some time here for questions, so I would like to ask our audience, if you have any question, any comment, please leave on the chat, let us know. Of course, I have some questions here to Alessia, but we will try to answer all of your questions. And of course, we are free. As I mentioned, we have a lot of different points to talk. So we are free, and I ask you from audience, first, where do you see the biggest friction today on access, on patient journey, on data or clinical communication? And with technology excites you most and worries you most in healthcare? Alessia talked about AI, about wearables, about telemedicine. So we have some questions here to explore. Feel free for sending to us your questions. My first question to you, Alessia, is when the start of your presentation, when you look at the future of healthcare, what do you think is the most urgent change we need to make? And especially, why is design a real lever, not just a policy, on this kind of transformation? You shared some numbers, but I would like to explore a little bit more about this with you.
I think that the biggest challenge is really about patient data. It is something that is still not there. And to me, let's say, the patient data and how they can travel across different ecosystem is still like an unsolved issue. Let me make it very tangible. I'm not sure how it works here in Brazil, but for example, in Spain, if you make your analytics with a specific health insurance, they are hosted in that system. If you want to bring those analytics to a different doctors, just to have like maybe a second opinion, which is very normal when we are in a diagnostic process, there is no way in which those analytics can be brought or sent automatically. So they not travel with you. You as a patient needs to move this data physically. And I had another example. I unfortunately 1 year ago, a very close friend of mine was diagnosed with cancer. And she was asking for a second opinion. And she had to literally take the sample, her pathology sample, from one laboratory to another laboratory to be able to have another test or another analysis about this test. So this is a huge friction that is preventing also to take advantage of AI, for example, or data technology, because this data fragmentation is becoming like a problem for the patients, for the doctors, and it goes together with the growth of data that we are producing. So we have more and more data that are all fragmented. So if you ask me, one of the very first things that we need to address is this one, which is not an easy one, because goes with regulation and ethics. Because of course, these are very sensitive data, and we cannot take the risk that those data goes or are treated in a wrong way, because it may have a lot of implications. I mean, also for insurance purposes. So that's a big challenge. Now, if you ask me which is the technology that excites me the most, there are two. I have been mentioning a couple of times the laboratory. That are those spaces which are like almost factories with a lot of instruments that are processing samples of our blood, for example, every day. And there is this vision that is not anymore a vision, because it's a reality in some country, of a dark lab. Why it's a dark lab? It's dark because it's operated by robots all the time, and so you don't need to have lighting. Now, that's kind of fascinating, because we are currently looking at not just so how to design for agent, can be robot or just agent, and what's the level of intervention for human in this equation. Amazon is already having dark factories, so to say, but that's how to apply this concept to the dark labs. It's quite fascinating. Of course, I cannot not mention AI, and let me refer to the example that I made before. So AI can become like a very, very powerful tool for managing health, for preventive diagnosis, for precision medicine. So let's say there are areas in which with AI we can really do earlier, do better, do sooner, intervene sooner. So really, what scares me about AI, if it becomes the substitution of the human connection that people is missing with doctors. While interviewing patients, what they are missing the most is not being able to speak to a doctor, to talk to someone. Because when you are sick or when you have a problem, it's not just fixing the problem. It's also, we are humans now, we are not just a piece of body. And the fact that the AI can become like a substitution for this level of emotional connection that people is needing, it's an opportunity and a challenge at the same time. So if you ask me, scares me a little bit, but maybe because I'm a bit old school. But I believe that we should develop a certain sense of responsibility or awareness toward those things. they are already happening, okay? I think that everyone is going to ChatGPT when they have a symptoms of something. But on the other hand, it's a bit scaring to me.
Perfect. We have some questions from our audience. I will ask you the first one. We will need a big orchestration of data, but how can we transform legal parts, person, companies, and government in a collaborative parts? What do you think about this? This is the question from Luis Gustavo.
Look, this is actually, thanks for this question. I think it's a very important one. One of my strong beliefs, and unfortunately I am not in the majority in this, is that to face the challenges that we have today, such as data, it's nothing that one company can do alone. You need like a level of coordination and collaboration among different entities. I personally believe that frameworks such as open collaboration, open innovation should become the way to go. There is no other way, okay? Because you cannot address patient data without an agreement between private entities, public entities, regulation, law. So it cannot happen in a different way. And this requires, in some cases, also a political vision, because at the end, those things becomes political to a certain extent. I'm not saying right, left, whatever. They are political because they have to do with people. So I do believe that if we want to address the health challenges for real, this shift has to happen, especially if we want to ensure accessibility to health. If not, we are going to create a major and bigger, I would say, gap between who has access and who has not. And by the way, we will not fix this problem of fragmentation of information, which is really counterintuitive. In the age in which we can process information and make sense of information as we never were able in our life, we are not able to aggregate the information or to make the information talk to each other so that we can take the best use of this processing. Now, what's the danger? If this aggregation is in the hands of only few companies, this means that we could create another attention economy, which is the economy that has been based on Web 2.0 and social media and so on, which is good in many aspects, but also dangerous in other aspects. So for big shift in history, without a level of collaboration between different type of businesses, public, private, regulatory, we will have another, I would say, other monopolistic situation that I don't think will help. And we have seen the danger of this already.
Perfect. We have another question from Queiroz, I believe. Can you talk a little more about strategies for creating experience that remain accessible and adaptable for aging and cognitively vulnerable populations, especially considering that constant updates, new devices, and shifting interfaces make it increasingly difficult for them to learn, trust, and keep up with these technologies?
Look, I love this question because, as you might know, with Laercio, we have this project in common, and one of the challenge is actually how do we make more accessible digital solution for health for aging population. Here, let me be a bit, let me answer, how do I answer to the team of students? Because what happened is that they have been making some research and they come back to me and say, no, but elderly people, they will never use digital technology, never. But then they have been showing me the personas, and in the personas profiling, the specific persona that was called maybe Luisa, I don't remember, 67 years old. She was using the main application that in Catalonia, in Spain, is used for access public health, and she was using WhatsApp. And my question was, okay, then that's not true that she's not using digital technology at all. She's using something. No, which is behind what she's using? When it comes to the application, for example, for the public health, they made some processes almost compulsory to happen in this application. So let me put in this way: she has been forced. It's an approach, okay? Some processes, and they will have to learn. What I think is more interesting is what happened with WhatsApp. The thing of WhatsApp that has a high level of accessibility also with aging population is that at the very end, despite has been acquired by Meta, so it could become like a monster like Instagram or Facebook, it became, in essence, extremely simple and is very anchored to a specific thing. It's a chat. And the interface kept this simplicity. So when you ask me, okay, how can we design for aging population or with cognitive vulnerable population, I think that the answer is really taking simplicity in design is not an easy thing, because we believe that we can make things simple, but it's not just reducing the amount of step. Things are simple if they respond practically and efficiently to a clear need. And they are doing that thing, and that's it. So this is a little bit my answer, really designing those technologies so that the level of simplicity is anchored to a clear use case, a clear understanding of the need, without adding extra stuff, because less is more. And whenever we are thinking at those, I would say, those populations that are, I would say, may have some barriers, I think it's very important to observe in depth their behavior, because many times we have this feeling that they will not use it because this is what they say. But then in reality, they are doing different things. So there is always this dichotomy between what is said and what is actually people doing. And sometimes in this difference, we can find a possible solution.
Perfect. I really love this kind of magic that designers sometimes can do, exactly acting on this gap. It's perfect. Alessia, we have a comment and also a question from Ivan Boing, and he say, millions of people are resorting to AI chatbots to question about their aliments or personal pains, physical or otherwise. I believe this trend will continue and could jeopardize integration. Do you agree? Because they are getting their emotional connections from AI.
That's a very good point. As I was mentioning before, AI or AI agent are really playing this role of becoming like a companion. And here, actually, it's interesting to observe the behavior of Gen Z, or let's say the very, very young people, and how they develop a relationship with those type of technology, and that's becoming especially true if we think an interaction model that goes beyond prompting with text, but are becoming like conversational. Okay, so when you can start having a conversation with an agent that looks like or that provides you the emotional needs that a human being will give you with, and they are designed with this intent, by the way. So this is becoming, as I would say, dangerous and interesting in the same time. I'm not sure if this will go against integration, because if I understood your question right, okay, what AI is actually doing is AI is fixing this fragmentation, because you can search everywhere, okay? The point is, depending on where AI is searching and depending on the data that are provided, you can have a very how can I say, dangerous type of information. And then again, when especially we are thinking at people that can be in a more weak position for cognitive reasons, for age, for emotional reasons. So AI may fix the fragmentation. The point is, the way it can fix the fragmentation, it has some danger. So it needs to be highly regulated. And this thing about this, the data that are behind, and the quality of data, and the it's really key. I was listening to this talk a month ago or so, and I didn't know about that, but apparently all the there is like a step in using data for LLM that is really categorizing all this data. This categorization happens in African countries. So the human being that are making this tagging and labeling are people coming from a specific culture, and they are applying also specific, I would say, cultural rules and norms. So there is the risk that those data can be somehow biased in a way or another. So this is the danger, in my opinion. And unfortunately, again, this requires so it's a challenge that sometimes goes beyond what is in our immediate control. So we cannot fix it, but I think that what we can do is being aware and creating knowledge and alphabetizations about those risks. That's our responsibility, because as designers, so in design, there is a huge level of responsibility, or at least designing things so that the bias is more evident and clear. So we can design for awareness. We can design so that people understand better which is behind. And that's unfortunately or likely our biggest challenge in the future. How can we design things so that people can understand, have more visibility? So technology should become a little bit more transparent in its ethical implication. And this can happen if by design.
Exactly. Alessia, we have a comment from S. Queiroz. Thank you for the answer. Loved the insight about simplicity. And we have another good question from Beatriz Ferreira. What do you think we should prioritize to ensure innovative health solutions are both scalable and responsive to local contexts, while continuously integrating feedback from frontline health workers?
It's a difficult question. You guys are really like top notch. So what do you think we should prioritize to ensure innovative health solutions are both scalable and responsive to local context? I don't get completely integrating feedback from frontline health workers. Again, personally speaking, I believe that there is there are two things in my opinion. On one end, we should have a real. So I am laughing at the comment. So good job, Laercio. Now, on one end, there is a real, as you might know, this idea of decentralized healthcare is becoming like a big thing, and this needs to be orchestrated. Okay, let me come back to this important word, orchestration. It needs to be orchestrated so that the service makes sense at these different layers. So I strongly believe that this decentralization, if well done, can make health becoming more accessible in remote areas, in disadvantaged areas as well. And we are, for example, also looking at technology that becomes more portable so that we can have some sort of real-time testing, and we are not just selling medicine, but we can provide like a much more distributed diagnosis. Okay. Together with that, decentralization may go together with preventive health. So if it's true that we are monitoring a lot of data, we should start make sense of all this data and, let's say, combining them, make correlation that are helping to anticipate a disease. I make an example that is really far away, almost now. When I was doing my PhD many, many years ago, we designed this mattress for an incubator for the premature newborns, whose main problem was actually to have a respiratory problem, and then they had to be intubated. That for a premature newborn is an extremely painful procedure. On the other hand, we wanted this newborn to be as close as possible to their family, to have human contact, body contact. That is so important in these very, very early stages. So what we did was, okay, we design a mattress with pressure sensors. So instead of monitoring other parameters, we monitor the respiratory movements, because there were some papers that were demonstrating that by studying the respiratory movements, you could predict respiratory problems well in advance. This is an example of how we can make use of data in our environment, in what we wear, okay, in a smarter way, so that we can really anticipate something. And this, together with this decentralization, can actually make health more accessible. On the other hand, and here I would like to go back to the idea of simplicity, when we talk about the frontline health workers, the biggest challenge today is their burnout. Okay, these people is overwhelmed because there is like a growing demand, and they are still the same people that have now to process a huge amount of digital information. In a talk that I did, well, if you go in an emergency room, you see a lot of screens, okay, each providing a different level of information. Those screens do not talk to each other. So as a human being, you need to process all this data that are fragmented by design. This is what we have to do. We need to design solutions that are decreasing the cognitive load and the cognitive effort, therefore, that those people in the front line are actually suffering every day. I remember this nurse is telling me, yes, of course, now everything is digital, and you think that you made us a favor. You didn't make us a favor. For us, it was much better to have everything on pen and paper. Now we are traveling with, I don't know how many digital devices. No, they have the pocket full of different type of stuff, and that's not actually good for them. So I think that there is still something in how do we, in our capability of simplifying. Simplicity is an art. So let's not underestimate the value of simplicity. And our capability of making use of this data in a smarter way that we have not yet completely used. Okay, we will soon, but hopefully in a good way. Because again, owning data goes always with the risk that if the data are in the wrong hands, they become like just business for few people and not access to a service for the majority of people. And this is where we need to find the sweet spot.
Perfect. Alessia, we are going to the final part of our meeting, unfortunately, because I'm really loving this talk and these discussions. I would like to thanks all the audience for the questions, for the comments. And from my side, I have a final question. You told about the collaboration we are working together. And related to this, my question is, what changes when we design healthcare solutions across different cultural contexts. Where do São Paulo and Barcelona complement each other as living labs for applied innovation? Just to mention, we are working together in a global design challenge related to healthcare, and you are with Barcelona IED students, and I'm here in São Paulo with students from São Paulo. So what do you think can emerge from this kind of collaboration?
I think that the beauty of this collaboration when it comes to healthcare is that, in a way, Sao Paulo and Barcelona, Brazil and Spain, Europe and Latin America represent like two very polarized contexts. Europe is a little bit, I would say, reluctant to change, okay? So because of maybe some sort of regulations, I have maybe in Europe, especially Germany, it's one of those countries where making change happen takes more time, okay, when it comes to digital. While I think that Brazil especially is becoming a little bit the laboratory for new type of health service. We've seen this also, for example, in other countries such as India. And let me give an example. The direct-to-patient testing, so having testing without a medical prescription, is something that in Europe doesn't exist. But we see this happening more and more, for example, in other geographies. So I feel that having these two countries will help to really explore the whole spectrum of what the transformation in healthcare can be, understanding also which are the different, let me say, usage model and business model that can be enabled in each of the different continents, responding to just a different culture or a different way to respond to change. So that's why I believe it's especially beautiful, this connection, because we can draw a line and understand actually which are the also the cultural element that will play a role, because they are always playing a role. So we better know them.
Perfect. Alessia, I will share a final slide here with our audience. Just a minute. Here. Well, first, I really would like to thank you so much, Alessia, for this great collaboration, this sharing of knowledge, and all these discussions we had tonight. And I'm really happy with this, as I mentioned, this global design challenge we are working together. So I'm very happy with this. And for our audience, for those who want to join our institution here in Brazil, we are starting new groups of students this month on March, and we have a gift for the audience, 5% discount for new courses we are starting this month. So if someone here is interested in joining us at IED São Paulo and interested in understand better the design, strategic, and innovation ecosystem, there is a great opportunity here. But to finish, I would like to thank you so much, Alessia. It was really a pleasure. And I wish to receive you personally in next opportunity here at your campus in IED São Paulo. And we see soon going ahead with this global project, and at the end of this year on the international model in Barcelona.
Thank you so much. I also, first of all, thanks for the invite. It's been an extreme pleasure, and thanks for the questions. Very, very good reflections. That's not an easy topic, so we need our best energies. And I really hope to come and visit you soon And I hope also to receive you soon in Barcelona. So absolutely. Thank you so much. It's been an extreme pleasure to be here with you tonight.
Thank you, Alessia. Thank you, our audience. Bye-bye, and see you on the next Design in Focus. Thank you.
Bye. Ciao.